Good day. I am Manole Cojocaru, Professor of Physiology and Immunology at Titu Măirescu University, Faculty of Medicine of Bucharest, Romania, Senior Scientific Researcher Degree 1, European Specialist Laboratory Medicine, Senior Specialist Allergology and Clinical Immunology. I am honored to present you the theme nutraceutical strategy for psoriatic disease. What does the future hold? Psoriasis is a common skin inflammatory condition affecting 3% of the worldwide population. Evidence for dysbiosis as a source of disease pathology is well documented in inflammatory skin conditions such as psoriasis. An increasing body of literature suggests a crucial role for the gut microbiome in modulating systemic inflammatory disease. Psoriasis is a chronic systemic inflammatory disease, and its pathogenesis is related to the interaction between genetic susceptibility, immune response, and environmental triggers such as diet, stress levels, skin care, routine, etc. Notably, the pathogenesis of psoriasis, similar to other immune-associated skin diseases, is based on close interactions between components of the adaptive and the innate immune systems. Furthermore, diet appears to play an important role in modulating disease activity, perhaps by influencing gut microbes. The gut-skin axis is a novel concept of the interaction between skin diseases and the microbiome through inflammatory mediators, metabolites, and the intestinal barrier. The dysregulated skin microbiota may become a novel therapeutic target in psoriatic patients. It is known that also calorie restriction and the low-calorie diet can improve the symptomatology and the development of psoriasis. Correct food choices may have a crucial role in the pathogenesis of psoriasis. The concept of the gut-brain-skin axis emphasized in mental health disorders may also regulate the health of skin. Like the skin microbiota, the composition of the gut microbiota and its association with psoriasis are unclear. The skin-gut axis concept provides a new insight to investigate the association between the intestinal microbiota and the skin. This offers a feasible approach for improving skin conditions by the modulation of the gut microbiota. Lifestyle and dietary habits might be related to the incidence and severity psoriasis. The concept of the brain-gut microbiome was supported by preclinical studies published during the past decade. Several types of neurotransmitters secreted by gut microbes were selected to investigate their potential function in psoriasis. Microbiome-mediated interventions could be designed to manipulate these targets for the treatment of psoriasis. Furthermore, studies also found that an important connection between emotional states and inflammatory skin conditions can be regulated by bacteria of the gastrointestinal tract. Through an extensive review of the literature, we aim to discuss the skin and gut microbiota and redefine their role in the pathogenesis of psoriasis. With the help of Danny Brand, Gheorghe Giurgiu has developed several nutraceuticals for psoriasis that act as immunomodulators of the human microbiome. Hence, it is crucial to understand nutraceuticals' impact on the psoriatic skin microbiota, which is thought to be perturbed. Our study provides insight into the skin microbiota in psoriasis and how it is modulated by nutraceuticals and diet. Deniplant prevents and treats the internal causes that trigger and maintain psoriasis by naturally modulating the intestinal and skin microbiome. Removing dysbiosis by the intestinal microbiota can prevent and eliminate complications caused by psoriasis. It contains cultivated medicinal plants, berries, and flora, fruits, tree, buds. With the understanding that the brain-gut-skin axis exists, it is now clear that intestinal microbes have significant effects on psoriasis. These results are supported by clinical observations based on a case series showing improvement in psoriatic skin lesions after antibiotic treatment, modulation of gut microbiota by probiotics or fecal microbial transplantation. We confirm the association of psoriasis and gut microbiota dysbiosis. This study provides a detailed and comprehensive systemic review regarding gut microbiome in patients with psoriasis. These results are supported by clinical observations based on a case series showing improvement in psoriatic skin lesions after modulation of gut microbiota by Deniplant nutraceuticals. Food choices can affect microbiome composition and improve the severity grade of psoriatic disease. You can see the patient with psoriasis before treatment and after treatment. Because Deniplant treatment addresses the internal causes that trigger and maintain the disease without ointment or other medications, its duration depends on how quickly the body resolves dysbiosis of the intestinal microbiome and can be between 4 to 6 months. If the disease is older, the treatment can exceed 12 months. After all the lesions healed, there were patients who never had psoriasis again, but there were also patients whose disease appeared 10 to 15 years. In conclusion, unfortunately, the direct link between the skin microbiota and the pathogenesis of psoriasis remains to be clearly established. Treatment of psoriasis, similar to other immune-mediated complex diseases, is limited to improving the symptoms due to the lack of effective therapy. On the basis of these findings, the treatment of skin inflammation by nutraceuticals is favored since its therapeutic management is simple, safe, and cheap. Thank you for kindly invitation. Thank you for your attention.